Hello and welcome to the anemia lecture. This is your objective 6 in your syllabus that we did not cover, so I wanted to make sure that I covered this because this is very important. This is part of the objectives. We're going to go over some causes of anemia, iron deficiency, chemotherapy, renal failure, menstrual disorders, leukemia, sickle cell, and aplastic. Before I move on, and I would try to do this in 15 minutes. I would try. But let's just talk a little bit about anemia. Anemia, most of us know that it is a reduction in the number of RBCs, red blood cells. It is the amount of hemoglobin or the hematocrit, which is the percentage of packed RBCs per deciliter of blood. It is a clinical indicator, not a specific disease, because it occurs with many health problems. Now, don't forget that anemia can result from dietary problems, genetic disorders, bone diseases, or excessive bleeding. GI bleeding is the most common reason for anemia in adults. I want to reinforce that despite all the many causes of anemia, the symptoms and the nursing interventions are similar for all types of anemia. So there are many types and causes of anemia. So some are caused by deficiency in one of the components needed to make fully functional red blood cells. And then we also have others that are caused by decreased red blood cell production or increased red blood cell destruction. Or it could be just chronic RBC loss. But please don't forget that despite all the things I just said, the symptoms and the nursing interventions are similar for all types of anemia. You can follow along with me in your book, in your chapter readings. I'm on anemia. I'm looking at table 40-1, and it's somewhere in the 800s, 814, 815, something like that for the page number. But these are the different types of anemia that we all should be familiar with. And according to your outline in your syllabus, we will focus on sickle cell disease. And I want you to look at the common causes over to the left. And then we do have the glucose 6-phosphate. I won't focus much on that. You do have the autoimmune hemolytic anemia. Do know about it. You do have the iron deficiency anemia. And of course, that's inadequate iron intake caused by iron deficient diet, chronic alcoholism, malabsorption syndrome, partial gastrectomy, and also rapid metabolic or anabolic activity used by pregnancy, adolescence, or infection. Very important. Also, you want to read up on your vitamin B deficiency, which is dietary deficiency. Failure to absorb vitamin B from, guess where? The intestinal tract. And then as a result of some patients get it from the partial gastrectomies, pernicious anemia, or malabsorption syndrome. We do also have the folic acid deficiency anemia and also the aplastic anemia. Sorry about that. Okay, so right over to the left side, you guys can read that in your book and look for the common causes of these different types of anemia. Let's talk about vitamin B deficiency. There is a condition, and I forget what page it's on. There's a condition known as glossitis. It is a characteristic of vitamin B anemia. If anemia is a pernicious anemia, it is treated with cobalamin. That's COBALAMIN. I wanted to show you some pictures of patients who are anemic or mildly anemic. And you can see the before and after, not before and after, but comparison. I have one more also. This patient is or has severe anemia. Look at that conjunctiva. Here's one more picture of symptoms of anemia to help you remember. Patients are feeling weak or tired all of the time. short of breath, increased susceptibility to infection. I did show you the conjunctiva, and also cold feet or hands. They always complain about their hands and their feet are cold, and also pica. So pica is something where they have this craving. Some people have a craving for things that just out of the ordinary. For example, like this young man is chewing on paper. That's his pica. Some people chew on something called starch, or some people like to suck on ice. These are all their picas. So their own particular craving, not necessarily healthy craving at all, but these are their picas telling you that these people or these patients are anemic. And here are some key features for anemia that's found in your book also. And you can read through each one regarding integumentary signs and symptoms. Make sure you read those. Pallor, especially of the ears and nail beds. Look at your patient's nail beds when you're checking capillary refill. The palmar creases, the conjunctiva, which we talked about, and all the others. Cool to touch, intolerance of cold temperatures. Look at the cardiovascular signs and symptoms. I would advise you to know the different signs and symptoms of anemia and the different areas or the different areas that it influences, like integumentary signs and symptoms. You should know that. Cardiovascular signs and symptoms, you should also know that. Respiratory signs and symptoms, and neurological signs and symptoms. Not sure how you can remember this, but make a flashcard or something so you will understand the signs and symptoms of anemia. Let's talk a little about I can't talk. Let's talk a little bit about iron deficiency anemia. It is the most common anemia worldwide, especially among women. Pay attention, older adults, and people with poor diets. So it can result from blood loss, like I said before, poor GI absorption or of iron and an inadequate diet. A lot of times the older population just don't have the money to buy the food that they need, and therefore they're not eating the proper amount of iron in their diet. So sometimes it's financial. So don't leave that out of the picture. I know it's know what the book said also, but it's also sometimes a financial problem also. They just don't have the money. The problem with anemia, of course, is a decreased iron supply for developing your red blood cells. So any adult with iron deficiency, they should be evaluated for abnormal bleeding, especially from where? The GI tract. Normal ranges for your iron, your ferritin values are 12 to 300 ng per ml or 12 to 300 mics per liter. I really need you guys to look at the pathophysiology in your book for iron. I'm going to move over here so you can see exactly where I'm reading from. So it basically talks about iron deficiency anemia. Also down here, vitamin B deficiency anemia. Know your macrolytic and your microlytic. Remember that, the large and the smaller ones. And also going down, we also talk about vitamin B deficiency. Deficiency anemia may be mild or severe and usually develops slowly. Indication of this type of anemia include pallor and jaundice, and look what's in blue, glossitis. So there's a picture of glossitis in your book, figure 40-3. Look at that so you can see that. So when you're doing your patient assessment, you can understand what's going on with these patients and how we can encourage them to eat foods high in iron. This is glossitis. This is on figure 40-3 in your book. A nice good picture of glossitis, a smooth muscle tongue as a result of vitamin B deficiency. Read this area, read here, and then see the difference between folic acid deficiency anemia. And let's see, it's towards the end where I wanted to point out to you that it may have symptoms similar to vitamin B12, of course, but common causes of folic acid deficiency are poor nutrition, malabsorption. But poor nutrition, especially a diet lacking in green leafy vegetables. So you know that these things are high in iron. Green leafy vegetables, liver, yeast, citrus fruits, dried beans, and nuts. So that's teaching we can do to our patients concerning foods that are high in iron. I want you to read this area because it's very important. I also highlighted the area that I wanted you to focus in on too. All of it is very important. In your book, it also talks about aplastic anemia. It's a deficiency of the circulating red blood cells. I want you to read this area. The most common type of disease is caused by long-term exposure to toxic agents, drugs, ionizing radiation, and or infection. Okay, so read this area down here. I'm going to scroll up and show you something else. So it does talk about glucose 6-phosphate, which I'm not going to get deep into, but please read that because that's also a deficiency anemia caused by a genetic problem. Okay, so I want you to make sure that you pay attention to those. But I want to go back and go over right? I'm sorry to go backwards on you, but here I want to make sure that you understand that what thrombocytopenia is, pancytopenia, and leukopenia. I want to make sure you understand those. Read it, research it, and then it tells you like a little blurb right next to it. Leukopenia is reduction in white blood cells. Thrombocytopenia is a reduction in platelets, and a condition known as pancytopenia. Okay. Now, as a nurse, these are things that we should do for our patients. I want you to read the paragraphs. I'm not going to read it for you, but look at iron deficient anemia management. So it'll tell you what it involves, increasing different type of or intakes of iron. It tells you the source of that. If you also look down, vitamin B12 deficiency anemia is managed by teaching the patient to increase his or her intake of food rich in vitamin 12 and so forth. It gives you examples of that. And also for folic acid. So remember, our NCLEX boards are what are we doing about it. It's good to know the information. It's excellent to be educated on it, but also what are we doing about it? So these are things that you can guard yourself with and then relay it to your patient's condition. Also, here are the others. All of this is right in your book. I'm not taking it from any other source besides my pictures that I show you. But besides that, you have it right here. Okay. Let's talk a little bit about leukemia. It changes immunity, increase the risk for infection in patients with leukemia. Even when the blood count shows a normal or high level of WBCs, these cells, remember, they're immature. They cannot protect the patient from infection. So you guys see a high level, don't mean that, they've been protected. They're immature. So ask about the frequency and severity of infections, such as colds like influenza, pneumonia, bronchitis, unexplained fevers, during the past 6 months. So platelet function is reduced with leukemia. So therefore it interferes with clotting. So ask about, when you're with your patients, ask about excessive bleeding episodes like tendencies when they brush their teeth or longer after minor trauma, nosebleeds, increased menstrual flow, bleeding from the gums, rectal bleeding, hematuria, blood in the urine. So if the patients experience those episodes, they should notify their healthcare provider. As you read your chapter reading, you'll discover that with leukemia, fatigue is a common problem for patients with leukemia. Although patients are so tired, they really try to perform their own activities of daily living, but they might have to take rest periods. So maybe sometimes your goal might be you want to increase or let them do things on their own, but just let them do it slowly. So if they're in the bed and not really moving around and they finally get up to do something, wow, they met a goal. Okay, so we just have to understand that they do get very fatigued. I think I'm going to have to do a part 2 because I'm already at 1 minute left, and And we haven't finished the other things that are very important. So I'll do a part 2 on anemia. Stay tuned.